Welcome, everyone, to today's event, Crisis Management, a crash course for healthcare leaders. My name is Alexis Kaiser. I'm Newsweek's healthcare editor, and I'm honored to be your moderator for today's discussion. As healthcare leaders, you know that unexpected challenges are part of the job, whether it's financial strain, operational disruptions, or even reputational concerns. The good news is you don't have to go through that alone. We've assembled a top-tier panel of experts who have been in your shoes before. And today they'll share expert practices to help you navigate tough situations with confidence. Our audience today is made up of healthcare decision makers, and our focus is on insights that speak to the complexities of health system management. We want to make sure this is a productive conversation, so please note that our comment section is moderated. Keep your questions relevant and appropriate, and we will address select questions from both the panel registration form and the comment section in the final 10 to 15 minutes of the event. With that, we'll go ahead and get started. I'd like to introduce our esteemed panelists today, Dr. Robert Pearl, clinical professor of plastic surgery at Stanford University School of Medicine and a faculty member at the Stanford Graduate School of Business. He's also the former CEO of the Permanente Medical Group. We have Dr. Amy Compton-Phillips, Chief Physician Executive at Press Ganey. Andy Puterbaugh, President of Hospitals and Health Systems at Teladoc Health. Chris Berger, Senior Vice President of Communications at Advocate Health. And Mike Hamilton, Field Chief Information Security Officer at Lumify Cyber. Thank you all for being here. Now, to start us off, I'd like to hear from each of you. What's one essential component of a crisis management strategy, regardless of what the crisis is?
Going to throw that out there. I'll start. I will say planning. I will say planning because when the house is on fire, you don't want to be reading the instructions for the fire extinguisher. So, not only planning, but exercising that plan to make sure that you're going to have everybody appropriate at the table when something happens. You're going to need somebody there who is going to have to authorize purchases that you didn't budget. You're going to need legal representation. You are for sure going to need communications. I'm really excited to hear from Chris about that. So from my perspective, it's all about the planning that goes into it before the event starts.
I'll jump right in too. It's like I think flexibility along with that planning is exactly what's needed. So there have been very few crises that I've been involved in over 30 years where I've gone to play page 56 of a playbook where I've really busted out here's what I'm going to do. It's really great to have that plan like Mike talked about and to walk through that mentally before the actual crisis happens. But during the actual crisis, I think flexibility, knowing that there's going to be nuances along the way that are different than the exact playbook that you put together, and just that ability to flex in grace and in being able to really work the plan, but being ready that there's going to be a lot of gray, and you have to be able to work in that.
Let me build on what Mike and Chris just said, which is that often, in fact, most often, you can't predict the crisis. And I think the way you prepare for it is you better have a strategy. You need to know your values. You have to be sure you have a leadership team that you can trust to make decisions. Because once the crisis starts, time becomes of the essence, and the usual chain of command doesn't hold. People have to make independent decisions. And if they don't know your strategy, your values, and they don't know that you have confidence in them, they're not going to be able to do it. And if you wait till the crisis hits, it's way too late.
And Robbie, just to pile on what you just said, as well as what Mike and Chris said, culture, building that culture of high reliability that allows everybody in the organization to understand risk and how they individually can respond to see if they can mitigate it in the near term, but also escalate it if they need to, just because healthcare is so risky to begin with that there's continuously, there's 1,000 ways to get things wrong and usually one way to get things right. And so we really need to be prepared to both identify risks and mitigate them when they happen.
Yeah, I'll be the caboose on the train here. And I think I'll go to the front end of the process. All of this wraps together with a well-understood activation process and knowing the roles and responsibilities of your business continuity and disaster recovery team. I know that these tabletop exercises that we all have to go through come at the most inopportune times, and it's really, really hard to say I have time for it. But boy, they do matter. And when crisis comes, it comes with different voices, many different voices, different decibel levels. And I think, as was said, sometimes the most unvetted information travels at the speed of light. So we have to understand what we're dealing with. And to me, that's part of activation and triage on the front end.
Fantastic. And Dr. Amy Compton Phillips, you talked about the role of the organization and the workforce in a crisis management strategy. And you've written and spoken often about the concept of organizational resilience. Press Ganey partners with 41,000 healthcare providers. So it's safe to say that you've seen the full spectrum of struggle and success. What do you see that the most resilient organizations are doing differently to prepare themselves and redeem themselves in a crisis?
We had a fantastic stress test for the healthcare industry writ large in COVID-19. The beginning of this decade, the first 3 years of it were one prolonged crisis management period, between the viral crisis and then the racial justice crisis and then the workforce crisis, then the financial crisis. So what we found in our data, and like you said, we have data on about 90% of healthcare organizations across the U.S., is the organizations that did the best in being able to manage operations and be resilient in the face of prolonged strain were ones that invested in the principles of high reliability. That high reliability gives organizations the tools to perform as expected over time. It's about cultivating an environment where everyone in the organization, from the C-suite to the frontline worker, understands what it takes to minimize harm, manage risk, and respond nimbly when things go wrong. So it really is. And by the way, the principles of high reliability, when they were applied stringently across the aviation industry, kept planes from falling out of the sky. Now that things have, it seems like the culture's changed a little bit, and you can see where risks start actually resulting in harm again. So it is really what has set apart consistently high performers in the face of adversity to those that suffer great reputational, financial, or human harm.
Fantastic. And Chris, I want to bounce to you next, since you lead communications at one of the nation's largest health systems. What are the biggest mistakes that you see health systems make when managing crisis communications, internally or externally? And how can those mistakes be avoided?
Yeah, it's interesting. When you look at a lot of the crises that we observe, we've gone through ourselves. Really, the sharing of information is like the most important thing. And I've seen organizations share way too much information and then share not enough information. And I think there is a delicate balance there of understanding. And I think that's where these tabletop exercises and plans really help, because it gets your mind frame in that position of knowing what to share and not using your internal advocates, your employees, and being very clear in communication initially, I think is the most essential. They're going to be the most outspoken, that of anybody, and also be your biggest advocates in sharing the best information to friends, family, and others about whatever you're going through. So whenever anybody doesn't share that information appropriately internally, you can see it spew externally. And then from there, I think it's really about, like, depending on what the crisis is it something that's centered with that organization, your organization, or something industry-wide? I see a lot of times when it's an industry-wide crisis, there is too much information shared, and you become the centerpiece of whoever's trying to reach out to you for that information, whatever news organization, and you become the spokesperson sort of for that larger crisis. And that sometimes gets to be a problem as well.
And so when you're communicating internally with these employees who will go out and share the news with the community, do you have best practices for that? Should it be done in person? Should it be done by email? What do you recommend?
Well, it depends again on whatever the crisis is. But I generally think, whatever you share, what's internal is external, what's external is internal. And we all know that. And so I think having some very clear, like 5 things to know and that anybody should be able to recite, very clean, simple of what is happening and kind of the plan forward. And how do you get in front of that crisis in the future? I think really helps as you think through that. But definitely making sure that communication strategy, and that's where these plans, again, that have been alluded to, are really strong because you think through all those intricacies and lots of voices at the table that are helping you kind of make sure that it's a very, very solid plan for whatever you face.
Great point. And we've been talking a lot about planning for the future, but I want to go back to the past and talk to you, Dr. Pearl, about your time leading Kaiser Permanente. And in your 18 years as CEO there, I'm sure that you faced a number of crises and unpredictable situations. Can you recall a time that you were leading through uncertainty? And what would you do differently if you knew then what you know now?
Let me actually start with right before I became the CEO, which is when I was the head of the largest medical center in Kaiser Permanente. It had 500,000 members, thousands of physicians, tens of thousands of staff. And we were doing pretty well until one day the Loma Prieta earthquake struck. All the power goes out immediately. And there I am having to figure out how to manage through a crisis that California hadn't seen in 80 years or some number like that since the one in the 1920s. And within a matter of minutes, someone came by and said, there's a crack in one wall of the hospital. What are we going to do? That's a real crisis. And as I said earlier, you need to have your strategy. How do you make a decision of this sort? You don't have time to bring in all of the structural engineers, to bring in the state, to bring in the other individuals. There's not even anyone you can call. The phones are out. You have to make a decision on the spot. And our strategy was we wanted to be the quality and service leader. And a quality and service leader, and the values are going to be, we're going to protect patients. Patient safety comes number one. So whatever we had to do, we had to get the patients out of that hospital until we could assure that a wall or a ceiling wasn't going to come crashing down and kill them. Now, remember, we're talking now about, at that time, in that part of the building, probably 100 patients. So what are we going to do? Well, this is where our pre-planning had come along. We had never planned for this type of massive destruction, massive damage to the building to occur. But we had planned what would happen if a plane crashed in Santa Clara County and 100 patients were brought to us with severe injuries. And we realized at that time that we could use the back parking lot with generators to be able to take care of all the individuals. So I made the decision that we're going to evacuate 100 patients and we're going to move them to the back area. Now, remember, we're talking about people, some are on ventilators. We're talking about people who have to come down 7 sets of stairs because it was a 7-story hospital at the time. And then another piece is that now you have to take care of them. And normally, say, one nurse could take care of 4 patients, but not in a parking lot. And you needed doctors who would be coming by a couple of times a day, but now you needed them constantly because there weren't enough nurses. And so I had to talk to the people. And I had to explain what was going on and tell them, I know you're worried because your families at home have experienced the same earthquake. But I need you here and here now. As soon as we have communications, we'll have you be able to connect to them. Once things are totally stabilized, we'll see if we can have some kind of rotation. But right now, we need you here. And I would say everyone stayed, took care of the patients. No harm was done. What do I wish was differently? I wish we had done some more planning. I wish we had planned to what would happen if a airplane struck the hospital and the hospital came down. How would we handle that problem? As I said earlier, you never could imagine every scenario, but I think we would have done even more planning than we had done.
Thank you. And on the topic of natural disasters like earthquakes, Andy, I know that Teladoc Health has been a huge help in the South with the hurricanes that occurred last summer and fall. You know, telehealth is such a critical part of disaster response nowadays. What are the biggest gaps in virtual care that health system leaders need to address in order to be prepared for a crisis situation?
Yeah, and Dr. Pearl, I admire your leadership, and I think you actually kind of started the answer to this question. We can't predict where the gap is coming from. That's the first and foremost unknown. We now have AI and tech disasters potential. We have biological and health disasters, environmental disasters. Now we're going to have cosmic and space considerations, social media, social and psychological disasters. So we don't know where it's coming from. We don't know where the problem lies, whether it's with us on our side, whether it's someone else's, whether it's a third party. For us specifically, bandwidth matters, connectivity matters. So while you have the physical presence that Dr. Pearl was just talking about, for a company like ours, it's about connectivity. And, I'm going to get to the hurricanes here in a minute, but if you go back to COVID, you look at the pandemic, we were operating at a capacity of thinking we had 2x the headroom on our systems. And overnight, instantaneously, we went from 20 to 40x of volume. And that's not a real comfortable position to be in. So the good news is that stimulated all of us to really leverage virtual care as a cornerstone. And when we're embedded with our customers and we're serving about 60% of the top 100 hospitals and health systems, when we're already there, our ability to scale workflows inside and outside the four walls is a very, very rapid process, and it's low code, no code kind of thing. And I've served several of the panelists here in their organizations in the past too, and I hope we've served you well. But when you look at the types of things that we're trying to do in business continuity and disaster recovery, it is making sure that we're focused on the patients, that we are focused on the same problems, that when you look at the hurricanes that have occurred, we had great leadership out of Tampa General, and they called and we collaborated on how to scale the system. And we were at our peak running about 25,000 visits during the recovery period remotely, but they didn't have connectivity as was described a minute ago. So we were using cellular. In the case of war zones, obviously the target is the communications infrastructure, but we use Starlink for some backup. But generally speaking, where we lean in is where we're needed and how we can scale quickly. And we've obviously secured a few new customers as a result of needing to respond rapidly. And they're typically things like in the California fires, you're going to have gen med visits to first responders and to the residents that are affected. In the case of hurricanes, you're going to get a lot of the upper respiratory hypertension, UTI, sinus infections, things that are pretty typical, either pre-existing or some that have come up. But I think the gaps are, you got to lean in quickly, you got to communicate well, and we're built for scale. So that's what we're doing with our customers. So wherever it comes from, that's the activation part I was talking about, and then we address what we need to address together.
Excellent. Thank you. And Mike, we'll turn to you next for a topic that I'm sure many of our guests today are interested to hear about, cybersecurity. That can be an intimidating topic even for the most seasoned leaders. And as we saw last year with Change Healthcare and Ascension, even the most well-resourced and large healthcare organizations among us can be vulnerable. So what are the common blind spots that you see in a health system cybersecurity that actually have a relatively easy fix?
Nothing has an easy fix. So the first thing I would do, especially with respect to resilience, everybody needs to admit this thing is going to happen. Okay, we are outmatched, we're outgunned, we're out-resourced. Okay, right? You're secure until your ticket is punched. Right. And then you have to activate, and then you have to recover. Right. And so really the more investment needs to go into detection and recovery rather than prevention. I mean, we all have to tick off our compliance boxes. Right. But if you boil this down, there are three prevalent methods for obtaining what we call initial access. Okay. Somebody got into your stuff. Okay. Number one, social engineering. We all know about that, and it's gotten really weird with deep fakes and faked voices and all that stuff, right? Number two, credential abuse, right? I'm going to try every password I have in this huge database against your account and see if I get a hit, and they probably will. And then number three is vulnerability exploit, right? So today, if you have a Sonic wall or a Fortinet firewall, you better get it patched right now because they're looking for you right now. Okay. So how do we deal with these, right? Let's boil this down to these three prevalent methods. Well, number one, you train your users. Okay. Obviously, there's no firewall for gullibility. You have to train your people. You should have a strict credential policy. Okay. Credentials, passwords that's aligned with the new NIST guidelines, National Institute of Standards and Technology. And it's not upper, lower, special character. It's have a sentence. Your password is a sentence. Change it once a year. That's a much better way to do it. But couple that with using a password vault for secure password storage and a prohibition against stored credentials in browsers, because your browser, you hit a website that's been compromised. It's got something called an info stealer, and all those passwords just get sucked right out. Okay. But the best thing you can do, okay, I'm going to leave manager vulnerabilities alone because that is a really big topic. There's something that CISA puts out called the known exploited vulnerabilities list. And if you have anything on that list and that vendor gives you a patch, you better get after it because they are coming for you. Okay. But the best thing you can do to move the needle the most with the least amount of effort is implement a policy of personal use on personal devices only. I used to be the CISO for the city of Seattle, and we took a lot of measurements, and I could prove then, and it's since been borne out in other research, that 40% of the compromised assets on our network were due to the use of personal email. So if Facebook and Gmail live here and not on your work computer, you just drove 40% of the problem off a cliff. And here's the interesting thing. Nobody's going to do that, despite the fact that you move the needle the furthest with that one move. Nobody's going to do that. It's going to make people grouchy. I know one organization, a hospital network in Kansas, that's done that, and it's been radically effective. So, this, I think if there's one thing you could do, that's the thing.
Thank you. Great advice. And we've talked a lot about getting the workforce on board. And Mike, you just mentioned how it can be challenging sometimes to gain that sort of continuity across the organization. What strategies have you all found successful for helping a large group of people plan for something that may or may not happen?
So Lexi, can I just chime in on something that Mike just said? Because one of the challenges we have in healthcare is we are taking care of incredibly sick people day in, day out, every day. And it's complex and it's hard to actually get everything done that we need to get done to take care of these patients. And so there's this constant yin and yang, this pull between saying, how do I let myself get through the day? And if my day requires me being able to search literature on Google for me to take care of this complex patient that I'm caring for, we need access to that. And so it's constantly trying to titrate the line between what risk do we find acceptable risk, how do we mitigate that risk, and then how do we get accomplished what we need to get accomplished during our very busy days. So as we do that, I think that's where technology and tools and process come into play to say how do we help make sure that the people know what the risks are? How do we do things like practice? It's not just have plans and tabletop drills, but how do we practice? I ran clinical operations at Providence before coming over to Prestini, and we had practiced literally what happens if we get a patient with Ebola over January, and then we got that first patient with COVID in the U.S. And so the team knew what to do with this new virus. In our Northern California hospitals, we had practiced what happens if there's a wildfire, and then it was a year with what half of Northern California burned down, and we had to navigate taking care of our population of patients. But because we had not just plans on paper, we practiced. Our people knew what to do to respond, and so I think somehow coupling feasibility with practice with people on the ground is the best way to move forward for all the staff in the front lines that are the ones who actually end up responding to these crises.
Alexis, I'll at least start to talk about this topic, and others will, I'm sure, build on it and add a lot more to it. And I think we have to understand that whether you're talking about your employees, your peers, the media, it doesn't matter who it is, the first thing is building trust. And trust takes years to build and days to erode. And in order to build trust, you've got to be engaging in person. You can't build trust with email. You can't build trust when everything has gone through PR revisions and it looks like it came out of ChatGPT. No, it's got to have your personal engagement with those individuals. And that's tough. It's a major job for whoever the leader is going to be, but it's the job that you've got to do. You got to build, it takes years to build trust and brand. And that's what you have to do. If you don't have that trust and brand going into the crisis, you don't have a chance of succeeding in it. Then when the crisis comes, you need honesty. And that's why I go back to this notion of the strategy and the values sitting in place, because that's what allows you to do it. And people, if they trust you, will give you the benefit of the doubt. If you did something wrong, you've got to admit it. They've got to know that you're going to do that. And on the other hand, if you tell them, here's what we have to do, here's why I have to do it, I know you're not going to like it, but this is why we have to do it and how it builds with our values and our strategy, my experience is they will do it. And reporters will give you the benefit of the doubt. They'll at least listen to you with an open mind. And it doesn't matter who the individual is. If that trust is there, I think you have a reasonable chance of succeeding through the crisis. And if it's not, I don't think you got a chance at all.
Chris, do you have any thoughts on what Dr. Pearl said about being personable and having that connection to build trust?
Yeah, definitely. I think my answer was along the same way. A crisis is not the time when you build relationships. It's when your relationships are proved out. And I think that's one of the things I see a lot happening is people haven't invested into building those relationships. And then when the crisis hits, it's too late. It really is. There's some things you can do, but and this goes for people inside your organization. As you are working, you're in deep stress during crisis mode. That's when your stress behaviors will show. Everything will be evident, clear. Your true culture of your organization truly comes out, I think, during a crisis time. And if you haven't invested into building relationships, it really does show. And I think that's the biggest thing I always recommend. People don't waste time of building those relationships now, because you're going to need them during a crisis. And the same thing goes for media. That's why they call it media relations. And most people forget the relations part of media relations, of not actually building that relationship, because then you're trying to prove during a crisis what you're saying is true, or how you're turning the corner or something like that. And that's also really dangerous, because you're trying to build that trust during the middle of a crisis, which you'll have the deck stacked against you anyway. So I think that's a really, really important part.
Very true. And Andy, Teladoc Health, as you mentioned, has partnerships with multiple organizations across the country, some even on this call. What insights do you have about proactively building relationships and curating partnerships to make sure that you're supported in time of need?
Well, I think they have nailed it. Transparency, you got to own it. Empathize with others. Stay calm in the chaos. Investigate root causes together. It is a difficult scenario, and I think leadership matters. The ability to have, I think it was mentioned by Dr. Compton Phillips at the beginning in terms of process and culture. Those things matter long before any kind of a disaster hit. So, I try to be honest and open with our customers. I try to beat the phone call that I know they're going to make to me. I try to make sure that we're making ethical decisions and doing what is right for patients, and being vulnerable with communication at times, where sometimes somebody might say, I don't know if we should say that or do that. But at the end of the day, we're going to do the right thing. And we're going to focus on the patient, and we're going to solve problems together. We're going to get through it. Then we're going to debrief on it. And then we're going to go with continuous improvement. But you got to own it. And I think that's the most important thing.
Great. And as you mentioned, there can be some tensions when there's a situation like this that's unexpected and it arises. So when you have those tense feelings between executives, board members, multiple perspectives competing to make the right decision, what are the best strategies for maintaining alignment and making those rapid decisions under pressure?
So I'm going to go back to what everybody said, communication. And that communication has to be two ways. And it's steeped in the trust and relationships you've built during the good times that you can draw on during the hard times. So again, going back to any of the crises, like one of the worst ones that we navigated at Providence was with a school shooting and having to take care of the community after a school shooting, and making sure that the board knew that, very early, don't wait for them to hear about it from the news, make sure that they hear about it from the leadership, that the clinicians, the chief medical officer of the local facility taking care of the victims was communicating what they could in a way that protected health information with the public, because the public had a huge interest. But making sure and being able to listen in to what did the emergency room clinicians and the first responders need, because it's incredibly traumatizing for people who take care of school shooting victims as well as for the families of the victims themselves. And so making sure that those lines of communication are open and that are built on the trusted relationships that the organization invested in before something bad happened.
I'll add on to that. One of the things that I try to teach my team is to think like an executive. When there's a crisis and there's a decision that needs to be made on a communication or next step, I want them to come with a recommendation, present the problem that we're trying to solve, and then come with their top recommendation. Present some alternatives to show that they've thought through the issue holistically and what the risks are associated with each one of those alternatives. But what is the top recommendation that they would make and put their full weight behind? And that's, I think, what a lot of executives are looking for, that something's well thought through and here's the recommendation that I stand behind. Because I think a lot of times what happens is people just dump information and then expect an executive to just make the best decision coming out of that. And then, it's left to them. I think when they can show that there is a top recommendation, I think it helps so much with, really cutting through the clutter.
Great point. Mike, maybe you can kick us off with this next question, because I know that this happens a lot after cyber attacks and data breaches. How can health systems proactively manage legal exposure when something goes wrong?
That's a great question. So in today's world, because of what started with the California Consumer Privacy Act and then all of the privacy acts that are in different states that have this private right of action, if there is an unauthorized disclosure of protected records, that's followed by a class action suit. There are attorneys waiting for these announcements to go out, and they're going to jump right on it. They're going to create a class, and they're going to sign up plaintiffs, and that's just going to happen. So that's partially the legal exposure through that civil litigation. But what we see more and more are executives being accused of negligence, right? You weren't involved in risk management, and so the SEC, as the sector risk management agency for publicly traded corporations, requires risk governance to go all the way up to the board of directors. In the HICCUP, the HICP for healthcare, they talk about having executive fingerprints on risk management decisions. And so if you do those things, we've done a risk assessment, we have a corrective action plan, we take our risks that we've identified through a governance process, and there are executive fingerprints on the decisions here: accept, avoid, mitigate through the application of controls, or transfer through insurance. And after the event, and this is statute in several states, if you can show your papers, we were actually doing the right things, that provides a bit of a safe harbor against civil litigation. There's still going to be regulatory things, right? But I'm going to go back to this. It's going to happen, right? Doesn't matter what you do, this stuff is going to hit the fan. And so what happens after that really has everything to do with how long that tail is of all of the misfortune that's about to befall you, financial, with respect to litigation, brand damage, all of those things. If you have your stuff to show, right, we were doing all of the right things. We cannot fight the third largest economy in the world, which was what cybercrime was called in 2022, $8 trillion in global losses, projected to be 24 trillion by 2027. There's no way you're going to go glove to glove with those organizations, those actors, and come out on top. So it's preparing for the eventual event. It's going to happen. And then we are going to show everything that we've been doing to show that this wasn't our fault. It's because we're outgunned. And that does provide that safe harbor and that insulation from civil litigation.
That's great advice. And we've all been talking about the importance of being proactive and creating a plan. Is there ever a time when you need to veer off the plan? And how do you know when it is time to break away?
I forget who said it. I think it was you, Chris. You have to be flexible in that plan, right? You've got to be a little pliable because you have playbooks for things. We all have these playbooks for incident response. But the incident doesn't follow the book. So you're going to have to pivot. So I would just say that flexibility is probably, the biggest thing there. You're not going to be able to predict what happens. Writ large, you can say the following things are going to happen, right? There's going to be regulators involved. There's going to be an insurance company involved. There's going to be outcry from the public. All of those things are going to happen, and having individual plans for those, regardless of what the actual event is, we know those things are going to happen.
Dr. Pearl, sorry, go ahead.
There was a famous boxer who once said that every plan disappears after the first punch is thrown.
That's right.
And every crisis, you're going to have to change direction. The idea that you can have a plan that you came up in times of normalcy and it's going to apply perfectly in times of crisis, with all the pieces moving and things happening differently than you thought there might have been, it just doesn't occur. And that's why, again, I build off of the foundation rather than try to come up with a 30-page handbook. This is exactly what to do when 100 people are brought into your medical center and they've all been injured in some type of major disaster. No, you're going to have to be very flexible. And you're going to have to, again, go back to depending on your people, that they understand what to do, because you can't do it all yourself. You're going to need people who can make these decisions and make the right decisions, because the overall success won't be made by one person. It's going to be the sum of all the different individuals who put it together. Sorry, Amy, please go ahead.
Yeah, well, and I think you said it beautifully. What I was going to say, an example of being able to do that, and by the way, empowering the local people who are managing the care, managing the work at the front lines to make those decisions, exactly like Dr. Pearl did with we're going to evacuate and keep these patients safe, right? When the fires hit Northern California, we had numerous employees that either lost their home or were in a potential evacuation zone, and they wanted to come into the office, but they had pets at home, and they're like, do I leave my dog and my cat, or do I come into work? So the local leadership of the hospital set up a dog room and a cat room so that the employees that were in a potential evacuation zone could bring their pets. They had a horse area in the parking lot, because in Napa, people have horses, so that people could bring their horses, right? So it's just very different things. The cell towers all went down. So, speaking, Andy, to what do you do if you have no Wi-Fi and you have no cell towers? Well, they used the radio to communicate with staff to say who was needed where, when, because it turns out that radio waves go far enough that you don't need cell towers. So having that kind of local authority and permission to be able to meet the needs that you have at the time, I think is really essential.
Great points. And I keep thinking about what Mike said, that this, in a cyber event at least, it's something that's going to happen. It's highly likely that something does go wrong. And in a major crisis, whether that's a cyber attack or a natural disaster, if things go off course and you do lose trust with the workforce or the community, What do you all recommend doing to begin rebuilding those relationships?
I think it's just the transparency in your communication and, acting as a mature organization. Okay, this thing happened. We are going to find root cause. We're going to develop a corrective action plan. We are going to budget that plan. We're going to execute that plan. And we are going to minimize the risk of this ever happening again. And if that's the kind of language that you're using, it's just very matter of fact. We don't hide from this. We don't pretend it didn't happen. We say this thing happened, and here's what we're doing now. And I think really communication is the best tool that you have to rebuild that trust. Yes.
Yeah, I'll jump in there too. It's very similar. I think it's important to, as I teach my kids, fess up when you mess up, and but move on, and not just that, but like let people know what you're doing in that continuous improvement model to fix that issue, so that hopefully it never happens again. And I think Dr. Pearl hit on this before, was as much as you can, that personal touch and outreach through your network of people that you have in place already, all the stakeholders that you have in the community, use those to explain what's happened and what you're doing to repair the situation. I think it's so hard to dislike a person as opposed to a building or a brand or things like that. When a statement comes out and says the organization said this as opposed to a person, and the same thing goes for that personal touch of community relations. It really is important to have that. And then for me, I always try to blanket all bad news with good news as much as I can. Show the overwhelming good, because again, we all know that negative sentiment that is out there is so minimal. It's what we focus on a lot of times, is the negative sentiment. But when you look at the positive or neutral sentiment, it's usually in the 90 percentile, and just that tiny bit that is negative. And if you can get an overwhelming amount of that good news out there to kind of flood a little bit of the negative news, I think that always helps as well.
Let me build a little bit on what Chris just said. We are all intellectual people. That's how we got the kind of jobs that we have. But most people experience events, particularly bad ones, on an emotional level. And we often will rationalize and intellectualize. We'll have lists that go on. And we have to be willing. And I think it's very, very hard for leaders to feel the emotion of the people who have been hurt. It could be an individual patient. It could be a community. It could be the people, as Amy said, whose houses burned down in the fires or animals got hurt in the fires. And we want to talk about, we'll give you money. We'll bring in FEMA. We'll do something. But no, you have to be able to recognize their pain. There's an expression in medicine: no one cares how much you know until they know how much you care. They want to know about your heart before they want to know about your brain. And I think it's particularly true, not just in crises, but in crises with negative outcomes.
Absolutely. And looking ahead to 2025, what are the crises that you all are keeping an eye on? And how are you preparing for those situations that might wreak some havoc in the healthcare industry?
Well, I can jump in and start that. And I just want to recognize what was just said is all about authenticity and heart. I love that. And, we try to be hard on the issues, not on the people. But sometimes I have to be reminded myself that I'm being misdirected in how I'm trying to lead. So I want to be vulnerable in that regard. When I look into the future and I say, what are we trying to anticipate? What are we trying to address? Obviously the AHA is called workforce a national emergency. Do we believe that? Is there employee burnout, mental health stress? Are these things that we have to lean in on more aggressively? I know that nursing turnover is a little over 22%. And a lot of nurses are looking to leave their role in the next 6 months. And so you kind of have to say, how can, at least in my world, how can virtual care enable hybrid care, on-site and off-site care teams to collaborate and do things better to address some of those strategic imperatives of the C-suite to be able to improve access, but also to address the workforce shortage? And, one thing has been clear to me through this entire discussion and through many of the disasters that we've been through, and that is virtual care is just part of modern care delivery. It's now embedded in everything that we're doing. So we just have to make sure that we are focusing on the right things. And for me, it was access and it was workforce. Those are the two areas that we're leaning a lot of our solutions in on.
And I'd say invest in your people, build their skills, build their engagement, build the trust, back up mutual trust with the organization so that leadership trusts the people trust the leadership, so that when the next crisis comes, and we can do everything we can to manage the known knowns and the unknown unknowns, but events will happen. But being able to build the skill set so that everybody in the organization knows how to respond, knows who to communicate with. And then when it happens, to listen, be authentic, be honest, and be brief.
I think for us, as we think about like the, top vulnerabilities, certainly what's been mentioned before, the cyber involved crimes, AI vulnerabilities even. But for me personally, I always might gravitate towards social media and just the inability a lot of times for me to control the misinformation that's out there. And there's so many times when we know this is how consumers get their information, how they receive information, and what they actually believe. And so just being able to really navigate that world is very interesting, because we'll see so many things that are just absolutely untrue. And there's no fact checking, and that is what people are gravitating towards and believing, rather than any true news organization or outlet. And so that's probably my biggest fear going into these next several years, is just that continued trend of people believing too much on social media and their friends as opposed to fact and science.
And I have no end of things that I think are going to be bad problems. But I will say this. One thing I think that we don't put enough thought into is what the global geopolitical situation has to do with the operational continuity of our healthcare sector. There are lots of countries that want to knock down our infrastructure, and you've read the stories, and the Chinese are on our power infrastructure. They compromised our telecommunications. So if China invades Taiwan and we show up, all of a sudden lights go out, y'all got no power. And that is something that's very difficult to plan for on a very, very broad scale. And it could be a very, very broad scale. There's also this collusion between criminals and nation states where they look like they're doing criminal things, but it's actually to meet the strategic goals of a country. And so with all of that flying around right now, and getting closer and closer to what looks like a war, there is going to be collateral damage, and it's going to be right here at home. And so that's what's on my mind.
The point that I would make is that we fail to recognize how big healthcare is. It's 20% of the US GDP. Almost nothing of significance that's going to impact our nation won't impact medicine. It could be bird flu. You could see a mutation. We could have a pandemic as bad or worse than COVID. It could be something in the cybersecurity area. We're certainly seeing that. There's a tremendous degree of unrest coming out of Washington, D.C. today. Who knows what's going to happen with Medicare, with Medicaid, what's going to happen with NIH funding, the FDA, vaccines. We could have an entire list of topics that could change. And as Mike just said, we have the global opportunities that could happen through war, through invasion, through allies. And then we have climate that could affect everything from forest fires to floods to tornadoes. I just think that we need to plan for what we think might happen, but we need to be even more prepared for things that we don't recognize might happen, that will happen, because that's just the nature of crises, and leaders have to be prepared to address them.
No surprises if we can avoid them. Thank you all.
Although we'll see, there will be surprises.
Exactly.
There will be surprises, exactly as people just said. And so how do you have enough variability in the plans that you make that whatever comes, you have something to reach for?
Absolutely. And I want to take the last 10 minutes here to address some questions from the audience. So if you're watching live at home, please feel free to drop them in the chat. And we also have a few that were sent in when people registered that I'll be sure to get to. So our first question here is a timely one about the bird flu and fears of the next pandemic, food chain costs, animal infections. What can leaders do to let people know what is being done about these fears and how they're protecting the population?
I think we could learn a lot from what we did during COVID. So the bird flu, I would put that into the known unknown category of what we can do to prepare. And we know now, we need to plan on PPE. We need to ensure that we have isolation protocols. We need to ensure that we are working on a vaccine today so that we can get ahead of it. So I think that bird flu is almost an easier one to deal with than a climate emergency or a war or another mass shooting event in your neighborhood. So figuring out how to take what we did and what we did to prepare for the pandemic previously, what we learned from the pandemic, we can apply to the things that we know are a high likelihood to occur, and we'll be ready for them more effectively next time than we were last time.
Excellent. Our next question, how can messaging be balanced so as to be informative yet limit liability?
I think we deal with this a lot, just of what information to share, how much to share, all those type of things. And this goes back to my relationship with legal. I think one of the things I'm very blessed to have is just an amazing relationship with our legal team of, they're looking at things from the actual court system and I'm looking at things from the viewpoint of the court of public opinion. And so balancing those two and making sure that, again, as they're proposing an answer to something that's happening and they're looking at it from the liability issue and those type of things, I'm also looking at it from, what is the public going to think? What is the consumer going to think? And how can this, protect or defend our reputation? And so making sure that relationship is strong so they understand the heart of where I'm coming from, and I have a healthy respect for their opinion, and we usually come to a very nice medium in the two and be able to share something that is easy for the consumer to understand, and that helps also protect our liability.
I would add that there's a difference between being dishonest and being not fully comprehensive. There are things you can't say because they create liability for your organization protecting people. But I think anytime you're dishonest, you're eroding both your trust and eroding your brand. And I think leaders often don't differentiate those two parts. The second thing I'll say is, at least within an organization, people will respect the fact when the leader says, that's a question I can't answer because of the legal liability it poses for our organization. Because people expect that leader to be protecting the organization, the people who work there. So I think that's often a trap that people fall into when they feel guilty. And so my best advice is, don't feel guilty by being able to be honest in the first place. And then the truth is always easier to tell.
And I like what Chris said. I tend to believe that when you put the same information out for all the people to feed on and talk about, you tend to arrive at a similar answer for how you're going to respond. And of course, somebody will have maybe more of an extreme opinion. That just comes back to your brand, our credibility, right? Our brand credibility is this company doing the right thing? Is this company taking the actions that I would have taken? Is it reasonable? And at the same time, you're always going to have debate about that. But I want to be known for doing the right thing.
Yeah, in the cyber swim lane, the rule of law is that if there's an ongoing investigation, you don't have to say anything. But I would say, being a communicator, and I would say have a professional communicator by all means, providing some information that goes right up to the limitation there and saying, there's an ongoing investigation. we are supposed to keep all this quiet, but let me tell you what I can. And being forthcoming, even though there's this limitation that would allow you to keep your mouth shut. And, going a little extra to, read people in a little bit, I think goes a long way.
Great answers. Thank you. And our last question here came in from the registration field. How do you manage situations of guilt by association? This chief marketing and engagement officer has 2 for-profit long-term care facilities in the market that made headlines for horrible care, and it's tarnished the others in the market and creates a lack of trust in the community. They're wondering how they can distance themselves from that negative press. Any thoughts?
To me, that sounds like almost and I'll give you an example. It's not in healthcare. There is a company that provides lots of tools for schools, and they were recently compromised. They lost all their records. So guilt by association, all of the individual schools whose records were lost have to file a breach report and go through all of that stuff. So that guilt by association is there. I don't know that you can do anything other than say, this wasn't a result of anything we did. This is through this third party who is now fired. I think that's the way to deal with it.
I would ask that when you have that emotion, you look at your own performance. And I think often when there's guilt by association, there's often a lot of other things about the industry that need to be addressed. And if you're going to try to claim to have a pristine environment, you're going to quickly lose the confidence people have. I say that only because yes, there may be one particular bad actor who makes a really horrific decision. That's illegal. That's illegal. We don't do illegal things. But I think that when you start to see yourself as being dramatically above everyone else, whether it's an insurance world or a hospital world or a medical group, it doesn't matter what it's going to be. Take a good look inside and make sure that if you live in a glass house, you don't throw any stones.
I think that's a great point to end on today. So thank you so much to our audience for joining us, and a special thank you to our panelists for taking the time to share their insights with us today. And before you go, I'd like to highlight our newest ranking of the world's best hospitals. It'll be released on February 26th, so mark your calendars. And it's an annual ranking done in collaboration with Statista, our data partner, that provides an in-depth look at what some of the best hospitals in the country are doing. So be sure to check it out. Have a great rest of your day, and we hope to see you next time. Thank you.
Thank you, Alexis.
Thank you.